Welcome to Mental Health Momentum, a Silicon Slopes podcast. I'm Dr. David Morgan. I'm a licensed psychologist and the director of mental health awareness here at Silicon Slopes. And on this podcast, we talk about mental health issues in business and beyond, and we look for solutions. I'm going to introduce my new friend to you today, Isa Perry. Hello, Isa.
Hi.
Can I tell them your secret about podcasts?
Sure.
That this is your first one?
Yes.
Okay. So I'm so glad you're here. And
Thank
we
you.
have your friend Alyssa to thank for referring you to me.
Yes.
Alyssa was super excited about connecting us and was thrilled that you'd be able to offer your insights here. So let me tell you a little bit about Isa here. She is the Health Strategy Manager at Davis County Health Department, where she coordinates Davis for Health, the county's health improvement collaborative. She's worked for 28 years as a public health professional and certified health education specialist serving Davis County. She is a passionate advocate for the health and well-being of her family, friends, neighbors, and community. I'm really glad to have you here.
Thank you.
So I was just thinking in 28 years, you've probably seen a significant shift in terms of what public health is worried about, right? And has mental health become a significant issue, I imagine?
Absolutely.
Yeah.
It used to be that you would think of mental health and just a counselor or the behavioral health provider.
Right.
But public health definitely has a role because it's affecting our communities at large in big ways.
Yeah, it really is. So do you have your own backstory of mental health, just like an interest in it or personal experiences?
I think I was oblivious to mental health as a young person, although I remember in sixth grade, I was an extremely shy child. And in sixth grade, I had someone following me at recess one time, and it was really scary. We'll come to find out it was some sort of assessment they were doing because I wouldn't talk to my teacher, and they wanted to see if I had friends. And I guess, shyness is a type of anxiety, and maybe it would be considered that. But as a young adult, I started looking into stress management and practicing. I guess I became intentional about self-care. And in my family, definitely have seen my mom struggled with depression and has for over 40 years. She's been to a treatment-resistant mood disorder clinic. I have family members who have been victims of domestic abuse, incarcerated, substance use, you name it. So I've been an advocate for them. I think it took 50 years of training, experience, education to finally be able to look back and see my life through a lens of maybe trauma, big T trauma, little t trauma, and recognize how my childhood experience has shaped me and impacted my self-protective tendencies. Also, just emotional maturity. And so it's been cool to have so much opportunity to learn and grow through my career that has led me to have some perspective on my life and my family's life and be able to support them through the things they go through.
I love that. And I appreciate you sharing that as well. I think so often what happens is we look back on our own experiences and what we didn't understand at one time, later, kind of in the light of new experience and more knowledge, we go, oh, that's what I was going through, or that's what was happening. And I think we're getting better at assessing that now and kind of identifying those things in people, not 30 or 40 years later,
Yes.
right? And being able to get in with better intervention sooner, which I think is great, because I think you're right. I think mental health has probably always been an issue. I think it's more of an issue now, like in the last 10, 15, 20 years. COVID was a huge thing, right? Did you see, so in public health, what was your experience with that?
It was pure insanity. Working 75 hours per week and just managing communication from our public health agency. And once we had vaccine, helping people get vaccine. But I feel like as people were so scared and their whole lives felt like turned upside down, I talked to people every single day in our community, and I just wanted them to know they still had choices, that what was best for their personal situation, it would still be there. They had that ability to choose, even though there were these guidelines that were really causing them a lot of fear and a lot of anger. They were calling very upset. But ultimately, I think when people felt like they had some choice in how they handled their family, that it was better. And I think the thing that was really hard for people was that lack of social connection, lack of tradition, lack of the regular things that would bring them joy.
Right.
I had friends who were so isolated during that time, and I didn't understand how significant their experience was until later, until they explained how going to the grocery store was the only place they felt like anyone even cared about them.
Yeah.
But in my situation, working in public health, we didn't go remote. We showed up every day as
Really?
early as
Wow.
possible and worked very, very long hours and with a huge team of people. And we hired hundreds of people to help us. And I was completely overstimulated almost every day. And I still needed my family on weekends. And I needed a little bit of normalcy and just to take that high stress
Hmm.
situation um, down a notch. But I just realized how my experience was probably exactly opposite of other people's. And because I was in a role to understand how some directives were coming down from the state and how to communicate those, I felt like I had a lot of control over the situation. I knew what choices I could make. I knew the latest information. And so I think that also allowed me to be in a position with, I wasn't worried about my well being per se and that of my family. I had the tools that I needed for them.
It was a fascinating experience just because it affected everyone all at once, right?
Yes.
And I don't know that anyone that's alive on the earth right now has ever had an experience like that. There have been some significant things like 9/11, was very, very traumatic, but there were people probably who hadn't heard of it, people living in remote villages, that didn't hear of that. But this was just everywhere all the time. It was like, and it really, I think it helped us understand, well, hopefully helped us understand, what to do in situations like that when life isn't normal, because that happens all the time,
Yeah.
right? I mean, just in small ways, right? In
Yeah.
small ways, life kind of gets turned on its head in our lives, and we go, no, now what do I do?
Yeah.
How do I handle this?
Yeah, I look at the things that prepared me to be able to be there and stay strong through that for the community and my coworkers. And it was the resilience that I built through other extremely challenging life situations where I thought, this is big, this is hard. How am I ever going to get through it? And then I got through it, was a little stronger. Then the next thing hit that was
Mhm.
even bigger. And then COVID hit. And so I feel like it was a progression. And I was thankful to be able to be there and hang in through it.
That's the least popular advice I usually give to people that are struggling with their mental health is I tell them, this is going to make you so much stronger. When
Yes.
you get through this,
Yep.
and nobody wants to hear that when they're in the middle of it. They think this is terrible. Tell me how this is going to be over as soon as possible. But it really is true. And there's no substitute for it, especially developing resilience like you're talking about.
Yep.
It just has to be developed through going through hard things.
Yeah.
And I mean, I guess that's the good news and the bad news is that bad news is you have to do it. The good news is you'll come out stronger on the other end. And then the next time, the same thing won't be as hard to deal with, and you'll be stronger to deal with more difficult things
Yeah.
that come.
Yeah. It reminds me of something we're working on as a self-care toolkit. And I feel like I'm pretty fanatical about self-care and not, it has a bad connotation at times. People think of it as kind of selfish, but we look at it as just rest and renewal, how you take care of your body,
Absolutely. Yeah.
how you take care of yourself so you're ready for the stresses that come. And I think that is a critical piece of maintaining good mental health. And we've chosen to look at it in a way of preparedness. So, how do you have that self care plan before crisis happens?
Mm.
What is your self care and/or safety plan during a crisis? And then, how do you revise that? And what does it look like, after you've faced
Right.
a significant challenge? And our community is so preparedness minded and has this self-reliance culture,
Right.
so we want to build on that. These are the things that you care about, so having a plan, to strengthen your resilience, to really identify those connections and daily practices that are important to you so that you can have the coping skills and the stress management skills you're going to need when those things happen.
Yeah. I like that you said how, in the community, there is kind of that that culture of self-reliance and preparedness. At the same time, I wonder how easily that extends to self-care, because it's not easy. It's simple to save money, right? I mean, you just put some money in a savings account if you have it. If you don't, then you can't.
Yep.
It's simple to buy extra food so that you might have, food in a time of crisis or something
Hmm.
like that. But when it comes to self-care and preparing yourself emotionally,
Yeah.
those are more complex issues. It's not just like, okay, you put the quarter in here and out comes more resilience. It usually involves things that people find uncomfortable doing in the first place.
Absolutely. Yes.
And so I would think that would be a tougher sell. I love it. I think it's
Hmm.
so important. I think too many times we're reacting to stuff instead of being proactive. And reacting always has us on our heels, and we're already reeling from what's happened, instead of saying, okay, let me get ahead of this for the next crisis, which will come. It's unfortunately, our lives are kind of set that way. There's always going to be some sort of drama that's around the corner. But I love that you're thinking about that. So Davis for Health, have you been there since the beginning of this?
Yeah. So, I mean, traditionally, public health was siloed around funding that you would get to address certain health outcomes. And this idea of working collaboratively with partners, we started it in 2012. And the idea is the strategic alignment, getting all of our sectors involved on the same page, identifying our community's greatest priorities, greatest needs. And so we have 65 different organizations that are involved. And it starts with a data deep dive. It's called a community health assessment. We do one every 5 years. We look at this broad data set of all of our local indicators. How are we doing in all aspects? And then we bring the local perspective, the cultural expertise. So public health is a science and an art.
Yes.
And the art is knowing your community and meeting their needs and doing things in a culturally appropriate way that will be effective. And so having all of our community members, our community leaders, our service providers at the table helping to guide our work is how Davis for Health works. And so in around 2013, that's when we started our first community health improvement plan, which meant we had to pick priorities based on our data.
Right.
And they picked suicide prevention and access to behavioral health services, improving access.
That was back in 2013.
Yes,
Yeah.
2013. And we've had a few other priorities, but those two have never left the plan in over 15 years. And we've changed the way we're tackling them and addressing them. We're trying to get farther upstream. We're trying to get at the root causes of negative mental, emotional, social well-being. And we're trying to improve the systems that exist and connect the systems that exist so we can help people get access to the things that they need, the services.
Right. So you mentioned this data collection, this every 5 years. What are some of the main data points? I mean, where are you getting this information?
Yeah, well, we have behavioral risk factor surveillance system data. That's self-reported adult data, representative sample. We have adolescent data through surveys done through the schools. And we also have been very diligent in collecting qualitative data or community voice, because the data doesn't really mean that much if you don't understand the life experiences behind it. So we've met with some of our underserved, underrepresented communities. We've done a resilience assessment, and we've looked at social and emotional well-being for adults. There's no data on that, but we found a way to study our own community. And slowly, those types of data are being collected across the state and across the nation, even data about adverse childhood experiences, positive childhood experiences, so ACEs and PCEs. And so isolation and loneliness are starting to become real common measures. So we just bring that all together. But when we have a gap in data, that's where I have an awesome team with some epidemiologists who we find ways to learn this about our community so that we can be those cultural community experts, so that it's not just one data point, but it's a whole story.
Right, right. And I love that it's localized as well, right? Because this is, I mean, Davis County, you're getting data from the Davis County residents, and so you're creating a plan of action that is specific to them.
That's right.
I love that.
Thank you.
That is amazing. So, what do you do to promote mental health awareness? Do you have like campaigns, or how does that work?
The main thing we do, and one of my roles is those strategic partnerships. So we have collaboratives where these groups come together to talk about just that. How are we going to increase awareness? So we have Davis Helps. It's our suicide prevention collaboration. We have a suicide postvention group that focuses on responding after a suicide or after an unexpected loss. What are the supports that the community needs? And we have a behavioral health collaboration where it's more about providers and removing those access barriers. So our role is sort of bringing everyone together, convening, get them in the same room, and then watching the magic happen as they network, as they work through the challenges of connecting community members to the services that they need. And we look at the data. We also look at what's the state doing, what's happening at the nation, so that we're always trying to align with best practices, things that are going on that we can capitalize on. But it really helps us to know we're not trying to do this all on our own, because no one agency could. These are big issues. And then we can just find those solutions based on the needs and the barriers and things that we're identifying. And sometimes we're trying to remove barriers. A lot of times we are. So as far as increasing awareness, we have some, like on the prevention side, where upstream means focusing on healthy relationships, parenting, abuse prevention, mindfulness, and many more. Just all of those things, healthy development. And so we recently did a healthy relationships assessment, found out there's 28 plus curriculums being taught in Davis County by different providers in different settings. So then when we know all that, we can share all of those instead of just one at a time. And we can also see, are there gaps in the types of healthy relationship education? There's parenting, there's dating, there's so many good ones that are out there. So that's just one example. When it comes to sort of that intervention or treatment, we lead some youth mental health screening events where we help plan the event, but Davis Behavioral Health and Davis School District are part of it, and other community agencies, so that we spread the word, and we can help with a free opportunity for parents to bring their kids and just see, is what's happening normal, or is what is happening needing some follow-up? And then we can immediately connect them to some of those follow-up services. And there's other examples in that tier of support as well. And then when there's that crisis or there's treatment needed, we are connected with our 911, our mobile crisis outreach teams, our receiving centers, so that we can champion the work that they're doing, that we can make sure all of our community knows that these crisis services are available. There's diversion services to help people stay out of emergency departments or jail. Just such a champion of our receiving center that Davis Behavioral Health was the first agency in the state to do. And there's peer support where somebody's been through what you've been through. And that's the key to the effectiveness of some of these services. And then, just that recovery or ongoing support. We've found over 50 support groups being offered in Davis County for people experiencing all kinds of challenges or loss or difficulties. And if they know there's a support group of people who can relate to them, that's just something where we can bring it all together and then get the word out through the networks that we have. People rely on us to keep them up to date. And our latest and biggest initiative of all is Davis Links. It's our community connector network, and it's our go-to source for trusted resources in Davis County. It's the brand that's bringing this all together, so that not only do service providers know where to find what's out there, but so does the community.
That's so valuable, because I think one of the problems people face when they're struggling with mental health issues or just other regular health issues is they don't know where to go. And I mean, especially with mental health, because you feel overwhelmed already, because, you finally got to the point where your depression or your anxiety or whatever condition you have is overwhelming you to where you don't know what to do. And now you're expected to navigate this extremely complicated mental health system in order to get the right services. And so this is so important for people to be able to go to a place that is where you guys have done the legwork.
Yes.
You've already vetted the things. You're
Mhm.
like, this is a good service. So as you're getting all these kind of stakeholders together, I could see maybe some saying, well, I mean, were like turf wars or anything like that? Or did they all just kind of drop that at the door and just say, look, we're here to help?
Yeah. That's probably one of the best things we have going for us in Davis County is our culture of collaboration. People just step up and they don't care who gets credit.
Yeah.
And I've seen that over and over again. Whoever, when we're applying for a grant, everybody's all in for whoever can do the best job with that pot of funding. And so there's nobody that didn't think this was a need. Everybody agreed that it was, but we didn't know who was going to do it. And they wanted us, the health department, in this role of convening and strategic planning and leading work groups. They want us to do this. No, it's not like the health department is always the best fit for this. Not many have been doing this type of work in this way. But in the role that we're in and with the trust of our community partners, we've involved them in naming the brand, setting the brand foundation, vetting resources, gathering over 1,400 local resources, and there's more. And they're just bought in, but they know it's their brand. They know it's their network. It's been amazing that way. Now, funding and sustainability is always a question mark. We can do this. We can get this off the ground. And there was some post-COVID funding that helped a lot of organizations do some things that they'd never been able to do before. But that's all long gone.
Right.
That's something we talk to our partners about. You wanted this and we've got it. How are we going to sustain it? So we've been brainstorming grant opportunities or partnering with healthcare systems, but even the business community, public health hasn't really talked business speak. We're just not trained to. And so while we show up and help businesses sometimes with events or mental health, just sharing resources, we haven't really communicated with them in a way I think we could to be more effective to reach our community in, how can we further the reach of this by partnering with businesses?
Yeah. Well, and it's in the business's advantage to look at this and to participate in this as well, because it's that rising tide that lifts all boats.
Yes.
Right? I mean, everyone that lives in Davis County, they're working in local businesses, and those businesses are being affected either positively or negatively by the mental health of their employees.
Yes.
And what you're saying is, look, we're just trying to help everyone get access to the resources that they need. And what I love even more than that is help them understand in advance what they can do to prevent these things. It was like I said before, we focus so much on remediation and very, very little on prevention. And maybe it's just because we think, well, it hasn't happened yet, so why should I worry about it? But it's going to happen. It's like our physical health. I mean, we're going to get sick, and there are things we can do to probably prevent some certain types of sicknesses by, eating certain things or not eating certain things or moving our bodies in different ways. So I love that.
Prevention and explaining the value of prevention and proving the value of prevention is a huge challenge because there's not enough resources and never will be to respond to crisis and all of the things that need to be in place when someone has lost everything or can't function or take care of their family or whatever it is. And so really, public health is looking at the best use of resources for the biggest impact for overall well-being. But it's a hard sell. It doesn't sound like it should be, but it is.
Well, Isa, I'm going to officially say that your first podcast recording was amazing. So
thank you.
You did a great job.
I appreciate the opportunity.
Thank you so much for sharing your insights. And if people want to learn more about Davis Links or Davis for Health, where do they go?
davislinks.org or davisforhealth.org. The contact us, I'll get those. So I'd be happy to follow up with anybody.
Awesome. Thanks again for coming in today.
You're welcome. Thank you.
And thanks everyone for listening today. Remember that change starts with you, and together we can increase our mental health momentum.